Hey there, fellow knowledge seekers. Welcome back to our channel. Today we are diving deep into a topic that affects millions of people around the world: the mysterious world of penicillin allergies. Have you ever been told you are allergic to penicillin or know someone who has? Well, you are not alone. It's estimated that millions of people have been labeled as penicillin allergic. But here's the kicker: a significant number of them might be wrongly diagnosed. So, what's deal with penicillin allergies? Is it a case of our cautions, doctor, misunderstanding symptoms, or something else entirely? Truth is, many individuals who believe penicillin allergies may be misdiagnosed due to a variety of reasons. Some patients have been experienced a side effect rather than a true allergic reaction. In this video, we are going to break it all down. We will uncover the common misconceptions about penicillin allergies and why they might be wrongly labeled. We will also talk about the potential risk of carrying this label and what is mean for your future medical treatment. Plus, we will explore the latest advance in allergy testing that can help you determine your true penicillin allergy status. And if you are someone who has told they are allergic to penicillin, stay tuned because we will discuss what to do next. Get ready for an eye opening journey into the world of penicillin allergies. Hit that like button, subscribe if you haven't already, and let's get started on our quest to uncover the truth. Don't forget to stay informed and always consult a healthcare professional for your medical concern. Thanks for watching, and we will see you in the video. Millions of people wrongly believe they are allergic to penicillin, which could mean they have take longer to recover after an infection. About 4 million people in UK have the drug allergy on their medical record, but when tested 90% of them are not allergic, research suggests. The Royal Pharmaceutical Societies say many people confuse antibiotic side effects with an allergic reaction. Common allergic symptoms including itching skin, raised rash and swelling. Nausea, breathlessness, coughing, diarrhea, and runny nose are some of others. But antibiotics, which treat bacterial infections, can themselves cause nausea or diarrhea, and the underlying infection can also lead to rash. And this means people often mistakenly believe they are allergic to penicillin, which is in many good, common antibiotics. These are used to treat chest, skin, urinary tract infections. But if people are labeled allergic, they are given second choice antibiotics, which can be less effective, low risk. Research has previously found there were 6 extra deaths per 1,000 patients in the year after they received a non penicillin antibiotic to treat an infection. Many individuals are at low or very low risk of having a genuine penicillin allergy. We often find that after careful investigations that they can take penicillin safely. Childhood allergy or one reported many years ago can also settle down and no longer can have the issue. Mild to moderate allergic reactions can usually be treated with antihistamines, but more severe reactions can be life-threatening. Signs of a reaction include raised, itchy skin rash, coughing, wheezing, tightness of throat, which can cause breath difficulties. Some common side effects of antibiotics can include nausea, diarrhea, bloating, and indigestion. Anyone who has had severe reactions in the past would need allergic testing and may be told never to take penicillin. The charity Allergic UK said many people had a label of allergic penicillin from early childhood that could carry with them for the rest of their life without ever being investigated. There is a now national effort to look into this, and the best way to approach it, clinical service said. There are long waiting time to see a specialist allergist for definite tests, but experts says that there are other ways to remove a penicillin allergic label. Compiling a detailed history of symptoms in many methods, this can be given to a healthcare specialist as a part of consultations. Testing for a penicillin allergy typically involves two main methods: skin prick test, allergy blood test. Skin prick test, this is the most often and initial test for penicillin allergy. A small amount of diluted penicillin solution is applied to your skin with the tiny needles, creating a small, controlled skin prick. If you are allergic to penicillin, you may experience redness, itching, or swelling at the site within 15 to 20 minutes. Allergy blood test. A blood test can measure the level of antibodies, immunoglobulin A, produced in response to penicillin. Elevated level of specific IgE antibodies may suggest an allergy. This test is typically used when a skin test isn't feasible due to skin conditions or other factors. It is essential to have these tests conducted by healthcare professionals, typically an allergist or immunologist, in a controlled environment like a clinic or hospital. These tests can help determine whether you have penicillin allergy. Penicillin allergy. If you are diagnosed with a penicillin allergy, it's essential to avoid penicillin and related antibiotics to prevent allergic reactions. Here are the key aspects of managing a penicillin allergy. Allergist consultations: consult with an allergy specialist, confirm your penicillin allergy, allergy test, and discuss the specific nature and severity of your allergy. Medical alert bracelet. Consider wearing a medical alert bracelet that indicates your penicillin allergy. This can be particularly important in emergency situations when you might not be able to communicate your allergy to medical professionals. Allergy action plan. Work with your allergist to develop an allergy action plan. This plan will outline what to do in the case of accidental exposure on allergic reactions, include medical conditions and when to seek emergency medical cares. Alternate medical process. Inform your healthcare providers about your penicillin allergy so they can prescribe an alternate antibiotics if necessary. There are several non-penicillin and allergic antibiotics available to treat bacterial infections. Desensitization. In some cases, desensitizations may be considered. Involve administering small, gradually increasing dose of penicillin under control medical supervision to help the body build to tolerance. However, this is not always an option and should be discussed with your allergist. Avoidance. The most crucial aspect of managing penicillin allergy is the strict avoidance of penicillin and related antibiotics. Education. Ensure that your close contact, such as family members and caregivers, are educated about the allergy, signs and symptoms, and the importance of avoiding penicillin. Emergency medication. In case of accidental exposure, carry an epinephrine auto injection. If prescribed by your allergist, use it as direct in your allergic action plan if you experience a severe allergic reactions. Remember that a penicillin allergy diagnosis in many change over time. Some people who were previously allergic to penicillin may lose their sensitivity over the years. Always consult with your healthcare provider and allergist to stay up to date on your allergy status and management. Alternate of penicillin. If someone is allergic to penicillin or if penicillin is not suitable for their conditions, there are several alternate antibiotics that can be prescribed, depending on the specific infection and the patient's medical history. Some common alternate to penicillin include cephalosporins. These antibiotics are structurally related to penicillin and are often effective against similar type of bacteria. Examples include cephalexin, macrolides. Antibiotics like azithromycin and erythromycin are effective against a range of infections, including respiratory and skin infections. Tetracyclines. Drugs like doxycycline and tetracycline can be used when other antibiotics are not appropriate. They are often used for treating acne and certain types of bacterial infections. Sulfonamides. Antibiotics such as sulfamethoxazoles are effective against urinary tract infections and other bacterial infections. Clindamycin. Clindamycin is used to treat various types of bacterial infections, including skin and soft tissues of infections. Vancomycin. Treatment of this is a potent antibiotics used to treat severe bacterial infections, particularly those caused by MRSA. Aminoglycosides. These antibiotics, like gentamicin and tobramycin, are used for serious bacterial infections such as certain types of pneumonia and sepsis. It's important to note that choice of antibiotics and the dose will depend on the specific infection, the result of bacterial culture and sensitivity testing, patient medical history, and the presence of any allergy. Your previous diagnosis was accurate. Remember, always consult with a medical health professional before attempting any allergy testing and never attempt to test for allergies at home without proper guidance.